All right, let's talk about the short-term exclusion. Yes, there is times when a child will be excluded from school. Okay, pause, delete that short-term stuff. We're taking a break right here, and then we're going to go to the next section. All right, so we just ended the first section on health policies and procedures. Now we are going to move to our next session called communicable disease. Let's get started. All right, so short-term exclusion and admittance. There are times when a child has to be excluded from school, and it's not because of behavior, okay? It is because he or she may have a communicable disease that is easily transferable to another child and or staff member, that child has to remain home, okay? So I want to reiterate that sometimes parents will diagnose their children as having this, that, or the other. Before we diagnose a child, let me rephrase that. We cannot diagnose a child. The diagnosis comes from the physician. We just follow the recommendations of that physician for that assigned child. So when a child is diagnosed with a communicable infection, the child will be temporarily excluded from class and may return after treatment has been completed and documentation has been received from the doctor's office. Okay? Do not send the return to school note to the health team, but instead place it in the child's files so it can be part of his records. Okay? There are some communicable diseases or viruses that does not require a note to return to school, such as pink eye. Pink eye, they do not need a note to return to school. Now, unless they keep the child off for 2 or 3 weeks, that's something totally different. But typically with your pink eye, the child can be out for 24 hours. Typically they're prescribed eye drops, and then they can return 24 hours after the use of those eye drops. Okay? Same thing with like bronchitis. Oftentimes the doctors may keep them home for start them on an antibiotic, but 24 hours after use they can return. Policy for health attendants. Any ailment or any illness that goes past 2 days, the child will need a note to return. So for example, and listen to me clearly, for example, the child is out on Monday and Tuesday and does not return on Wednesday but comes back Thursday, that child will need a note to return for because of that illness. If the child is out Monday and Tuesday but returns on Wednesday, that child will not require a note to return. That child has 2 days and he returned on the 3rd day. Now, let me throw a scenario at you. Let's say the child was out on Friday. We do not count Saturday and Sunday as an absent because nobody works on Saturday or Sunday. Or let me rephrase that. The school is not open on Saturday or Sunday, and the child is not required to be in attendance. So if the child is out on if the child is out on Friday, he's out on Saturday and Sunday because we're closed. He's out on Monday, but he returns on Tuesday. He does not need a note to return to school because that's 2 days. But if the child was out Friday, Monday, and Tuesday and returned on Wednesday, then that child would require a note to return. If the child was out on Monday because he was sick, but he came back on Tuesday, and he was out on Wednesday, and returned on Thursday. He does not need a note because those are individual absenteeism, because he came one day, off the next, came another day, home the next. Okay? These are consecutive days. So in reality, if you count up the days, it's 3 total days that the child is absent. He or she will require a note to return. So if the child, let's say the child comes to school Monday, Tuesday, out Wednesday, Thursday, come back on Friday, the child does not need a note to return to school. If the child is out Wednesday, Thursday, Friday, comes back the following Monday, he will need a note to return. So please, please, please communicate this information with your parents. As you're calling to find out why the child is out, make sure they know that the child will need a note to return if it's past those 3 days. Okay, so it's 2 complete days. If they come back on the 3rd day, they're good. But if they're out that 3rd day, they'll need a note to return. Okay, so work with the parents. Okay, if the child is out because he or she has surgery, we do need a note for the child to return, because we need to know if there's any restrictions for this child to return. Okay, next slide, please. If a child is found to have a communicable disease while in the classroom, the teacher will fill out an incident report. Let's say the child has a fever, okay, and they're sending the child home. The teacher will fill out that incident report. The teacher will notify myself, the health manager, that they have a child who has a fever of, let's say, 101.3 and is vomiting. They're going to call me with that information. I'm going to give them permission to send that child home. Then that staff member is also going to let their program manager know that they have a sick child in their classroom, that the child has a fever of 101 and the child is vomiting, and they have permission from Nurse Yolanda or the health team to send that child home. In the event that I am not reachable, I'm at a training, or I don't hear my phone go off, or whatever, then you are going to contact your program manager and you're going to say, I have a sick child. His fever is 101 and he's vomiting. And he or she will give you guidance. Okay? At the end of the day, you have to have permission to send these children home. Okay? Also, please, please, please send me, Nurse Yo, an email that you had Johnny Blue, who was in the classroom, who had a fever of 102.2, and he's vomiting, and we're sending him home. Why? Because we have to keep track of who we're sending home. Why? Because it's part of the attendance policy. Why? Because it's part of the performance standards. Why? Because the federal government keeps track of that information, okay? So please, please, please send me an email. I'll make documentation of Child Plus, why the child went home. Now, let's say you are in a building that Head Start is utilizing in a different school corporation, and you have a child in there who has lice, right? So we do not have a no lice policy, but our policy simply states that if a child has lice, he or she will go home, preferably at the end of the day, but you call the parents and let them decide. Let them know that the child has lice. Parent wants to come pick up the child at that moment, no problem. Parents can't find a ride and they're working on a ride, okay, no problem. Okay, you're going to monitor the child as you would any other child. All right. Mom picks up that child. She takes him home. She treats him. She cleans his head out. He can return the next day if she works that fast. Okay. but the child's head will have to be checked when he or she returns. All right, we do have teaching staff in this off-sites who have agreed to check the kids' heads, who have agreed to check the kids' heads. And we also have nurses in those off-sites who will check the child's head to make sure it is licensed before sending them home, and also to check the child back in. Now, some, again, off-sites, as I was saying, I was previously getting ready to state, they have a no lice and a no knit policy, which means if the child has lice in their building, they have to go home immediately, and they cannot come back until they are checked in by that nurse. Okay, so that's their policy. And guess what? We have to follow their rules. Why? Because it's their building. We are a guest in their building, and we have to follow their rules. Okay? Next slide, please. So, when is a child too sick to attend school? All right, I'm so glad you asked. If the child has a runny nose, he's coughing, he has a low-grade fever, 100.1, no, let's say 99.1, that child should stay home, okay? If the child is having diarrhea, that child should stay home. If the child is vomiting, that child should stay home, okay? Let's say child comes to school and suddenly the child is laying around the classroom. He does not want to participate, and he's having diarrhea out of his clothes or his diaper. Guess what? You're going to pick up that phone, you're going to notify me what's going on, and we're going to send that baby home. Okay? Anytime a child has diarrhea and or vomiting or a fever, they have to be at home for 24 hours minimum. Diarrhea free and without medication for the problem. Okay? So, let's say you got a child that has a fever of 101 and they are crying and they don't want to participate. And you call me and I say, let's call mom. We're going to send this child home because the child has a fever of 101.4. The child can't come back the next day, but he can come back the following day if he or she is fever-free without the use of medication for 24 hours. All right? That is the policy, right? However, mom comes pick up comes pick up the child, and the fever is 101.1. Mom takes the child right to urgent care. Urgent care says the child has an ear infection, and mom wants to send the child back to school the next day. She can, because we have a root cause of the fever. Okay? So she can come back in that instance. All right, and then you can just read through this documentation to see what else. All right, so what is diarrhea? This is diarrhea. None of the rest of this is diarrhea. All right, so again, make sure when you call me and you're saying that the child has diarrhea, make sure it looks like this and it is running out of the diaper or the child's clothes. Okay, that is diarrhea. And then verify it with your program manager, please. Okay, now let's throw this scenario out. We have a child who has had 3 diarrhea stools, but it has not come out of his diaper, but he's barely making it to the toilet, right? And he looks like he doesn't feel good. You're going to pick up that phone, you're going to call me, and you're going to give me an assessment, and more than likely, we're probably going to send that child home. First thing I'm going to ask, though, does this child have a fever associated with this diarrhea, okay? So make sure you're taking these child's temperatures, all right? Also, another thing, if you call me, let's say, first thing on a Monday morning, all Johnny do is wants to sleep. He doesn't want to participate. Does he have fever? Nope. Diarrhea? Nope. Vomiting? Nope. I'm going to say, let's give Johnny some breakfast to see how he responds to breakfast. Why? Because we're just coming off a weekend, and we don't know what type of weekend Johnny had. We don't know if he was up all night. We don't know if he had to stay at grandma's house all weekend. We don't even know if this child had any food. When the last time this child had any food. So we're going to feed this baby. And that's going to be my response for any child who comes to school that's not running a fever, that is mobile, and that's not having vomiting or diarrhea. I'm going to say, let's give this child something to eat. Why? because I don't know when this child's last meal was. And I want to make sure that we offer this child something to eat before we send that child home. And I don't know if there's any food in the house. All right. So our goal is to keep our kids in the classroom. And of course, we want them to be healthy, and we want them to be safe. We want them to be healthy. And in an event that they're sick, we will send them home. But I know that here at Head Start, it's a safe place. I know here at Head Start, the gas is on, the electric on, the water is on. There, we have those exceptions where the heater may go out or the air may go out. But, typically we have somebody on site to get that problem fixed. But I know that the child is in a safe place. And I also know that we have food and we're going to feed this child. So that's our goal, to provide a safe and a learning environment for these children. Okay. Next slide, please. So we talked about this, making sure that you notify me and your program manager of all ill and sick children before sending them home. Please do not just send a child home without notifying us, okay? All right. Another thing we want to make sure that we're doing, please, 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 make sure you're doing your daily assessments, okay? Especially for your early Head Start staff members. When these parents, grandparents, aunties, uncles, caregivers are dropping these kids off, please make sure you're doing a visual assessment as much as possible. You're looking for unusual bruising, looking to see if the child looks like he or she feels okay. If the child just doesn't look like they feel okay, it's okay to say, hold on, Grandma, let's take Johnny's temperature before you leave. Why? Because if Johnny has a fever, we're going to send Johnny right back home with Grandma. But you're also going to notify myself, the health team, and you're going to notify your program manager, okay? But while we have a caregiver there, we're going to take that child's temperature, and if the child has a temperature, the child will go back home, okay? Again, 9 times out of 10, when parents drop off sick kids and they know that the child is sick, you're going to have a hard time getting in touch with those parents. Okay, so do the best you can to get those assessments done while the caregiver is there, and looking again for unusual bruisings. And this is a time to have a conversation. How was Johnny night last night? How was Johnny morning this morning? Okay, so you want to ask those questions. And again, you're doing those skin assessments right then and there. Now, for Head Start staff, it's a little bit tougher to do those daily assessments before the parents drive off or after, and because of some of those kids catch the bus. So you have to do the best you can. But as soon as that child is released into your hands, you want to make sure that you're doing assessment right then and there. Okay, and the reason being is because here's a situation right here. Look at these bruises on this child right here. Okay, and there was some on her shoulders, and she had on a tank top. And so the situation was, the bus driver went to pick the child up from the mom. The mom took the child to the bus driver, and the bus driver accepted the child, strapped in the child, brought the child to school. School driver gave the child to the teacher. Teacher signed for the child. Bruises there. Everybody noticed them. No big deal. Teacher takes, at the end of the day, teacher takes baby back to the bus driver, gives the baby back to the bus driver, and she's a child anyway. She's like 3 or 4. Bus driver takes the child back home, releases the child to the parent, and mom is irate. And when she sees these bruises, what in the world happened to my child? Where did all these bruises come from? And immediately, what does mom do? She notified Child Protective Services, as she should. Why? Because her child came home with all these bruises. Even though the child was received that way, nobody noted it. Nobody made a note of it. Nobody noticed it. Nobody had a conversation about it. And of course, in doing our evaluations, when the bus driver was questioned and when the school teacher was questioned about it, first thing that they say, yeah, we noticed it, but we didn't think anything of it. Wrong answer. Anytime you notice excessive bruises on a child and you have suspicion about it, it is your obligation to notify your program manager, and more importantly, to file a Child Protective Service report. Now, of course, you get more information from that on your onboarding by Human Resources, but it is your responsibility. If you notice it or if you see something, then you are responsible to say something. Well, at the end of the day, and of course it took several days, but at the end of the situation, come to find out that the bruises actually happened at home, and our bus drivers and our teaching staff was left was let off the case. But nevertheless, they still had to go through being questioned and administrative leave and so on and so forth. And that's a situation that you don't want to be involved in if you don't have to be involved in. Okay, so make sure you're doing these assessments on these kids when they're released to you. All right, so we talked a little bit about lice. Yes, they are excluded when they're dealing with lice. For 2 days, of course. 2 days excused absence, although some parents do take longer than 2 days. But work with those parents to get that situation taken care of immediately. Okay. Sometimes children have croup. That's an excludable virus as well. Okay. They do need a doctor's note to return to school. Sometimes they may or they may not run a fever associated with this croup. Sometimes, again, not always, but sometimes they do. So, again, making sure that you're working with your parents when dealing with these communicable diseases to get these child back in school as soon as possible. Okay. Next slide, please. Okay. We also have pertussis. That is definitely an excludable virus. It's very contagious. Kids may be out anywhere from 7 to 10 days, maybe even up to 21 days. They're often started on antibiotics, and they will need a note to return to school. Okay. And we already talked about the croup. Okay. Next slide, please. Okay. Let's talk about ringworm and RSV. RSV, the child is excluded from school if he or she is running a fever, because sometimes they do run that low-grade fever and they have a continuous cough. And in those situations, the child does need to be at home with their parent, but they can return to school when they're feeling better and they're able to participate in activities. And they will need a note to return with RSV. Okay. And again, RSV is diagnosed by their primary care physician or, of course, a nurse practitioner. Ringworm, they can attend school with ringworm as long as it's covered up. But if it's in a spot where it cannot be covered up, then that child will have to stay home until treatment starts. And then they can return to school. And then oftentimes, parents typically just call their pharmacist and they get an over-the-counter antifungal cream, which is totally acceptable. They can definitely do that. But again, the important thing when dealing with ringworm that it has to be covered up. Okay. And they also need to consult with their primary care physician as well. Okay, next slide, please. Rotavirus, we talked about rotavirus. Looks like I got 2 of those slides in here about rotavirus. No, I didn't. I didn't talk about rotavirus. That was RSV. Okay, so rotavirus is another one of those contagious diseases that they will be excluded from school with because it's typically these kids have so many diarrhea stools that their stomach is just so tore up that you can't even keep up with it. And they can return once the diarrhea subsides. Anywhere, it's usually, it can last up to 8 days, but typically anywhere 3 to 5 days is usual for an infant with rotavirus. And I particularly usually just see this at the 0 to 12 months, sometimes up to 24 months. Okay, so again, lots of hand washing with this infection. Lots of hand washing with this virus. Scabies definitely excluded until they're on treatment, and they have to have a note to return. They're typically out 3 to 7 days as well. So these are communicable diseases, conditions, or viruses that a child is excluded from school during that initial time frame until either antibiotics have been started or treatment has been started. And then, of course, the symptoms themselves subside, and then they'll need a note to return. Okay, next slide, please. Chickenpox, definitely. Chickenpox excludable, come back once the chickenpox have scabbed over, and then there is no fever. Sixth disease, same thing. That's a virus. Typically, these kids are febrile. Sometimes they are even hospitalized. I've seen children hospitalized because of roseola. But these kids feel bad. They look like their cheeks look like somebody slapped them in the face because they're so red. They don't have an appetite. They just feel blah. So these kids definitely need a note to return to school as well. And you can read everything about these viruses as it's in your handout. So I'm not going to take the time to read through everything. Strep throat, same thing. At least 24 hours of antibiotics before they can return. Sometimes parents do keep their children home 2 days, 3 days with strep throat. When you start getting in 3, 4, 5 days with strep throat, they will need a note to return. The important thing with these kids is getting them started on antibiotics as soon as possible. And oftentimes these kiddos run a fever. So they may be out 3 to 5 days, depending upon how their body reacts to the strep itself and to the antibiotics. Hand, foot, and mouth, you'll see that a lot in the spring, fall area. Highly contagious, especially on children who are drooling. They run a fever. They have little bumps around their mouth or in their hands, the palm of their hands, the soles of their feet. Sometimes they even have it in their private areas. So they definitely will be excluded from school as long as they're having a fever, and until, if they're one of those infants where they're constantly drooling, until the drooling subsides and or the pus bumps crust over as well. Next slide, please. Measles, definitely will be excluded from school with the measles. And another thing with measles to keep in mind is the fact that if we have children who parents have refused to get them immunized, in the event that there is a measles outbreak, those individuals will not be able to attend school either. Okay, so just keep that in mind. Okay, next slide. All right, bed bugs. Unfortunately, we don't exclude individuals with bed bugs, but we do recommend that if you find a bed bug on a child, that you use like a piece of tape or something to get it off the child. Of course, putting your gloves on. Stick it inside a Ziploc bag so that we can show the parents the bug, the actual bug that we pulled off the child. It's a touchy situation, so when you're talking to these parents about this, be as gentle as possible, and then make sure you let them know that you're not stating that they're dirty or they're nasty or anything like that. You're only stating the fact that we found a bug on a child, period. That's it. And then you can also ask in a nonchalantly way, make sure you check your home. If you don't have any resources, reach out to the health department, because sometimes they do have resources that they can utilize to help families with bed bugs. Okay, next slide, please. Diabetes. Yes, we do have children with diabetes. And because this is a complicated, or can be a complicated condition, we work with the staff one-on-one when they have a child in their classroom with diabetes. This is just some signs and symptoms to watch for when you're dealing with a child that is exhibiting signs of hyperglycemia as well as hypoglycemia. But again, because the teaching is so involved, it's something that we'll sit down to do one-on-one training with the staff members involved.